Hi, Assalamualaikum. My name is Muhammad Shakir and my group member is Muhammad Farhan bin Khairul Azizi, Magatul Juliana binti Muhammad Rasul and Muhammad Shukran Afiq bin Abdul Aziz. Today I would like to present about my assignment 2 Ethics and OSHA. About my title is AIDS. Introduction of AIDS. What is AIDS? AIDS stands for acute immune deficiency syndrome. AIDS is a serious condition that weakens the body immune system, leaving it unable to fight off illness. AIDS is the last stage in a progression of disease resulting from a viral infection known as the human immunodeficiency virus, HIV or AIDS virus. The diseases include a number of unusual and severe infections, cancer, and debilitating illness, resulting in a severe weight loss or wasting away, and disease affecting the brain and central nervous system. There is no cure for HIV infection or AIDS, nor is there a vaccine to prevent HIV infection. However, new medication not only can slow the progression of the infection, but can also markedly suppress the virus, thereby restoring the body immune function and permitting many HIV-infected individuals to lead a normal, disease-free life. AIDS is transmitted via three main routes. First, the most common mode of transmission is the transfer of body secretion through sexual contact. This is accomplished through exposure for mucous membranes of the rectum, vagina or mouth to blood, semen or vaginal secretion containing the HIV virus. Second, blood or blood product can transmit the virus most often through the sharing of contaminated syringes and needles. 3. HIV can be spread during pregnancy from mother to fetus. Symptoms of AIDS: extreme fatigue, rapid weight loss from an unknown cause. 3. Appearance of swollen or tender gland in the neck, armpit, or groin for no apparent reason, lasting for more than 4 weeks. 3. Unexplained shortness of breath, frequently accompanied by a dry cough not due to allergy or smoking. Next, persistent diarrhea, and last, intermittent high fever or shocking night sweats of unknown origin.
Assalamualaikum. My name is Maizatul Zuliana binti Muhammad Rasul. Today I will present to you about history of the disease HIV AIDS. AIDS is caused by the human immunodeficiency virus which originates in Central and West African non-human primates, while multiple subgroups of the virus develop human infectivity at different times. The global pandemic began with the appearance of one specific strain, HIV-1 subgroup M in Leopoldville, Belgium in the early 1980s. Next is HIV is divided into two types, HIV-1 and HIV-2. HIV-1 is more virulent, spreads easily, and is responsible for the great majority of HIV infection worldwide. HIV-1 is closely linked to the virus found in chimpanzees of the pine troglodytes subspecies which dwell in the jungles of Cameroon, Equatorial Guinea, Gabon, and the Republic of Congo in Central Africa. HIV-2, like its closer sibling, a virus of the Soti-Mangabe, an old world monkey found in southern Senegal, Guinea and western Ivory Coast, is less transmissible and primarily limited to West Africa.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Farhan bin Khairul Azizi. And now I am going to present about how does the virus corrupts the body, the HIV. Okay, so HIV is human immunodeficiency virus. Is a virus that affects the body's natural defense system, the immune system. The body has a hard time battling sickness if it doesn't have a strong immune system. HIV refers to both the virus and the infection it produces. This is um, stated in the introduction. Okay, so I will explain as how the HIV will affect our body. So the immune system relies heavily on white blood cells, and then the HIV virus will attack and kill the CD4 plus cells, and the cells is white blood cells. So the body can no longer fight itself against infection if the CD4 cells, the CD4 plus cells are eliminated by too many. So and then HIV is early stage, and it will advance to the final stage, and that is AIDS infection. The meaning is that acquired immunodeficiency syndrome. And then persons with AIDS have a low number of CD4 plus cells or white blood cells and are more susceptible to infections and malignancies than healthy people. This can be very, very extremely dangerous and very deadly to the people with AIDS. Okay, so next is the stages of HIV. So HIV have a few stages before it goes to AIDS. So the first stages is acute HIV, and the second stage is chronic HIV, and the last stage is AIDS. Okay, so for the first stage is acute HIV. This is the early stage of a HIV infection and might cause flu-like symptoms. These are some of the examples of early symptoms such as fever, headache, rash, swollen lymph nodes, fatigue, and muscle pain. So these are the symptoms for the early stage of acute HIV. It will be uh, a, a light symptoms before it goes to chronic HIV. So the second stages is chronic HIV. It's also known as the chronic stage. A person will likely not have as many symptoms at this stage as they did during the acute phase. This is due to the virus's low replication rate in the body. People with this stage of HIV may develop minor infections or persistent signs and symptoms as the virus continues to spread and damage your immune cells. So for the last stage, the deadliest stage is AIDS. So in this last stage, AIDS patients are susceptible to opportunistic disease as well as common illness as tuberculosis, toxoplasmosis, and pneumonia. Certain kinds of cancer such as lymphoma and cervical cancer are more common in those with compromised immune system. As we can see in this stage, the AIDS stage, uh, the patient will more likely to have deadly disease in AIDS. Okay, so that's all for my part.
Hi and Assalamualaikum. My name is Muhammad Shukran Rafiq. Today I will present to you the application of public health ethical principles to the AIDS and HIV epidemics. Okay, this is the application principle for the public health for AIDS HIV epidemics. It is divided into 5, that is autonomy, individual freedom and choice, non-malfeasance, harmless, do not harm the people who are infected by the HIV, beneficence, the welfare of a human being that are being infected, justice, the people who are infected by AIDS are not to be mistreated, and counselor needs to offer rationale that explain, fidelity, that is loyalty and faithfulness. Beneficence promote quality of life. This is to act in the best interest of people who are infected with HIV, is aligned with the principle of improving or maintaining high quality of life for the person living with HIV. Healthcare providers have access to clinical measures to access care delivery, but do not always have access to quality of life of measures. Beneficence support social relationships. The person who are infected by AIDS or HIV has lack of social relationship and support. Because of this, healthcare professionals are encouraged to practice beneficence and involve family, friends as the patient requests. Because low level of social support can give negative effects such as isolation and depression. Non-malnutrition, stigma in care. The person living with HIV may not have equal perceived opportunities and access to HIV treatment and care because of the stigma that provided by others. It can become a barrier for the person who are infected by the HIV. Because of this population of groups will not seek medical care and attention, including screening for HIV, if faced with stigmatizing situations. Social stigmatization. These are some of the ethics issues that is related to HIV and AIDS, such as disclosure, disability rights, economical resource, employment rights, medical and treatment, suicide, and duty to warn. Okay, that's all from me. Thank you.